welcome back to Reddit Aliens. I'm John, and as always, thank you so much for being here. Good topic? Let's do it. Mental health professionals of Reddit. What's the worst mental health illness that you've ever heard of? Please remember to like, share, and subscribe. Cotard delusion. I'm a nurse and had to take care of a huge man with this condition. He came in with some odd behavior and escalated to Cotard. Delusion makes you think you're actually dead. He would scream he was dead all day and night. Lived in constant terror. He was such a sweetheart, but became so worn down and terrified over time, he got quite dangerous and punched a nurse in the face. Dementias. Watching a person, their memories, their personality die, but their body remain living and confused is horrifying. Delusional parasitosis comes to mind with this prompt. I've watched a patient go to well over a dozen doctors trying to get confirmation that they're parasite-ridden. After countless stool samples, blood work, lab scans, biopsies, etc., she clearly didn't have any, but remains convinced. I don't have it, but my psychiatrist referred to anorexia nervosa as the 7-year disease, because in 7 years from diagnosis, you're either in recovery or dead. Though not a medical professional, during my brief time working at an outpatient facility, I encountered a patient with body integrity identity disorder, BID. Convinced that his arm wasn't his own, he consistently described it as feeling like a stranger's limb. His intense desire to have his arm removed led him into a deep depressive episode, culminating in a self-mutilation attempt that ultimately needed amputation. Post-surgery, he claimed to finally feel a sense of peace. However, I left the job, so I don't know the lasting impact on his mental state from the surgery. BID is still a relatively unknown identity disorder and doesn't have many treatment options so far. SSRIs are usually given to alleviate depressive symptoms, but it doesn't always seem to help. Going through something like that just seems like an awful experience. Dealing with those obsessive thoughts nonstop, that's gotta mess with your head big time. Childhood disintegrative disorder, nightmare fuel of the highest order. The child starts to regress in development, language and speech starts deteriorating, owing acquired motor skills, losing ladder control, progressing until they are vegetative and non-communicative. The person that the child was has disintegrated completely. We have no idea what causes it, nor any treatments, no detection of it beforehand. But what turns it into pure nightmare fuel is that there actually is one preceding symptom. The child is utterly gripped by fear and intense feelings of something being very wrong with them, often complaining to the parents that something is terribly wrong with them. Prosopagnosia. I had a patient with this as a therapist. They report to the ER because their face fell off. The only thing therapy could accomplish was to teach patient how to use other markers to identify people. Capgras syndrome. The idea that people around you were replaced with imposters. This one is absolutely hell on everyone. And in neuropsych, definitely primary progressive aphasia. Basically, you aggressively lose the ability to speak and understand language. I had a patient once that was late to their appointment, and when they finally got there, they were pissed because none of the signs were in English. They failed all of their language tests, but passed all the other markers to rule out dementia. This person was an avid runner, vegan, perfectly healthy, and would likely go on to never be able to speak or understand anyone speaking to them within 5 years or so. They had lived a long life due to no other health concerns. I have a friend who works with seriously disturbed patients and told me about a woman that habitually drank hand sanitizer. Apparently, when you do that, your joints lock up, and you have to be immediately rushed to the ER for treatment. And what do they have in the ER? Every 10 feet or so? Yeah, more hand sanitizer. So this woman would have to be restrained, otherwise they would find her in the hallway, pumping it directly into her mouth all over again. Schizophrenia, hands down, no contest. 90% disability rate. 30 years shaved off a natural life expectancy, astronomical suicide rate. Common comorbidities include both mental health and physical disorders. Some people still think schizophrenia is DID, which obviously it is not multiple personalities. But a less ignorant, yet even more common misconception is that schizophrenia is a monolithic disease. That is, it shares an underlying pathology between cases that causes it. The reality is that schizophrenia is nothing more than a cluster of symptoms, and there are many different pathologies that can lead to those same symptoms. Part of the reason schizophrenia has a reputation for being the be-all and end-all of insanity, you cannot go more crazy than schizophrenia. It does not exist. Schizophrenia is the end of the road for all madness. ETA, this blew up. Apparently, it could use some clarification. The thing that makes schizophrenia so dangerous is not the disease itself necessarily, but because it almost never exists in a vacuum and isolated from other disorders. The extreme amount of comorbidities with schizophrenia, including practically every other mental illness and some physical illnesses, is what makes it such a killer, and the major contributor to shaving decades off of someone's lifespan. Many people with schizophrenia will self-medicate for their symptoms, and substance abuse definitely does not help. Let's not even mention the meds. They suck ass. Even if they work to control psychosis, the side effects are legendary for how awful they are. You pack on the pounds like it's nothing. Some of them can cause diabetes to manifest, and any number of other terrible side effects. Akathisia, aka perpetual restlessness. It is the be-all and end-all of madness because it bleeds into everything. Reading about it, and I've read plenty about it over the last couple of years, but you almost take it for granted because it's such a common phrase in the vernacular of everyday life that when you really look at what schizophrenia can do to the person and to its family, then yeah, it's definitely up there. I heard about a guy who thought he was on fire all the time when he was awake, so he screamed until he passed out, day after day. How can you even treat that? Paranoid schizophrenia is no joke. I had a patient that was so convinced that aliens were watching his life through his eye, so he tore it out with his bare hand, and didn't even regret it. I work in psych-intensive care. We have a guy with autographia as a form of self-harm. He ate huge chunks of flesh off of his arm when he was hearing voices. That was pretty bad. Drugs are the worst though. Meth literally burns holes in your brain. I've seen brain scans from patients. Lots of people who are revived post-opiate overdose have hypoxic, anoxic brain injuries. It's like they've had a lobotomy. It's awful. Those drug-related brain injuries are permanent too. They'll never be able to live independently ever again. I'm not a professional, but I have an immediate family member who is a diagnosed schizophrenic and borderline personality. It's one hell of a combo. Honestly, mania. People's lives get ruined because of one manic episode. Thousands of dollars spent, random flights booked, and ending up on the other side of the planet with no way of getting back. More adjacent to the field, but one person who compulsively ate glass. They'd break light bulbs and windows just to have something sharp in their mouth. They'd be at the ER every month. One person who ate dirt. They would pack so much dirt into their mouth until they could not breathe. One person who was in the system since adolescence. They would compulsively have sex with whoever. At 18, they started sneaking out their window, undressing outside of the facility, and offering themselves to homeless men. Yeah, I look at the world differently now. Not a medical professional, but for anyone interested in these cases, I strongly recommend a book called The Man Who Mistook His Wife for a Hat by Oliver Sacks. It describes different case studies, including people with aphasia, face blindness, people who feel their body parts aren't their own. A man fell out of bed because he found a strange leg in his bed and threw it out. It was his own leg, hence he fell together with it. Outside of thought disorders like schizophrenia, scrupulosity, OCD, is pretty brutal. Basically, it's this fixation on going to hell and the person is convinced they're going there no matter what. At its worst, it's all they can think about and talk about, distracting them from work and family. Knowing they'll burn in eternal torment one day slowly drives them mad. I worked in mental health years ago. We had a patient that had been institutionalized her entire life. She used to insert pens and pencils into her arms and legs like an IV. It was horrendous. She was so sweet otherwise. Anorexia and borderline PD have the highest all-cause mortality risk and suicide risk. Both reduce life expectancy by about 20 years, and if they're in combination with other disorders, substance abuse, etc., even more than that. This is partly because of increased suicide risk, but also due to factors like increased risk of unhealthy lifestyle, the combined metabolic burden of substance abuse and medication, and the effects of constant stress. Also increased risk for blood-borne diseases and STDs like hepatitis, etc., because of risky sexual behavior. 10% of people with BPD commit suicide. For BPD, this percentage is skewed heavily towards men. 20% of men with BPD commit suicide, but only 5% of women. This is at least partly because men often choose more immediate methods like jumping or firearms. That's not attempts, that's actual suicides. Clinical depression. Sitting in a room with someone and you can feel the void around them. It's like a complete emptiness. I worked with someone who accidentally set their bed on fire while smoking and was just watching it, like they were watching daytime TV. Zero emotion and zero reaction to move from it. Just chilling. I'd say the worst has to be schizoaffective disorder. It's basically a combination of both schizophrenia and bipolar depression disorder. Yes, when you aren't having a psychotic episode, you're having a manic episode. Schizophrenia is one of the worst mental disorders, but mixing it with another one? That's hell. Not mental health care, but I work in hospice. The worst case of dementia I ever saw was a woman who had hidden her childhood trauma from her children. When got dementia, and her only remaining memories were of abuse. She spent her days scream-crying and trying to break herself out of her room, bloody fingers and all. It was horrific for her family, staff, and her husband. Worst thing I've ever witnessed. Some of the rarer dementias. There's one that literally turns a perfectly normal person into a psychopath. All their other faculties remain intact. They are dementias that literally melt your brain and don't even have a name. There are rare familial types of dementia so specific to certain families that they don't have a name but can develop really early. And again, you know it's coming your way. And then there's Huntington's, which you likely know you're getting and have seen your loved ones go through it first. The embedded hallucinations in Lewy bodies can go either way, very distressing or comforting. With the non-organic illnesses, it's a toss-up between treatment-resistant psychosis and severe emotionally unstable personality disorder for the impact on quality of life. For any medical professional, if he or she would ever come across it, it's got to be fatal familial insomnia. There's nothing they could do but watch the patient waste away. If said patient doesn't kill him or herself first, it's exceedingly rare, thankfully. Only 40 or so cases as of 2022. Not nearly the worst. Pica, eating things that aren't food, is probably the worst I've seen, but dissociative fugue really blows my mind. I've always wondered how many missing person cases are just the result of DF. There are no specific pharmaceutical interventions for BPD itself, but pharmaceuticals can help with accompanying issues, and BPD actually does respond quite well to psychotherapy, which is a medical intervention. The difficulty lies in getting someone with BPD to go to therapy and stick with it.